transplant that look very realistic and that you cannot detect. So the science and art of hair transplantation has come a long way, and it's indeed a very viable option for restoring hair for those who are interested in having it done. All manners of hair loss can be addressed effectively by hair transplantation. And hair transplantation is perhaps the most effective means of restoring hair. It's the, how do you say, probably the surest means of actually growing hair in an area that is bald. Because all other treatments may or may not work, or they will work to a certain degree or not. But when you do a hair transplantation in a qualified or suitable candidate, the chance of success with stunning results is very, very high. That said, we still need to remember that not all cases of hair loss should or can be transplanted. So I believe that's the thrust of this talk today, informally, to know when you are a candidate for a hair transplantation and when you should back away from hair transplantation, even when offered. Okay, so the typical candidate for hair restoration is a person that has what we call androgenetic hair loss, which is hair loss that results from genetics inherited from your parents and manifested by way of hormonal reaction to the male hormone in the hair follicles. At least in males, we know that is the case. In females, that is still debatable, but we call them androgenetic alopecia in general. And that is the most common cause of hair loss worldwide. And that is a huge population that we will say qualifies for hair transplantation. That said, there are other causes of hair loss, specifically since I'm addressing an all-female tribe of my sisters and mothers in the African and African diaspora. I will need to focus on hair loss situations that are more common amongst this demographic. So I would like to kind of focus on that because hair loss as a topic is a very huge topic and we need to stay on focus. So the most common cause of hair loss in women of African descent, in my experience, is traction alopecia. So that's when you lose hair in the edges, usually, typically on the temples and then the hairlines. But depending on how the mechanics of it is, you could also lose hair on the back hairline. And that is when you have a grooming practice that somebody engages in, usually from childhood, that entails, exerting, putting force on the hair root. So grooming practices like braiding the hair tightly, tight ponytails, tight weaves, heavy dreadlocks, things like that. And that's a very common practice amongst women, especially of African descent. Because of the hair type, this kind of grooming choices becomes necessary often. And that is the cause of traction alopecia. The next cause of hair loss in this demographic is something we call, it's scarring alopecia. It's called...
Thank you for watching that video, and I hope you learned something new today. To watch the full video, I would like you to join us at the Good Hair Tribe, where you have access to this video and many more amazing contents to help you in your hair care literacy. See you at the Good Hair Tribe.